Our topic is alcohol and substance use while pregnant, and my name is Stephanie Mercado.
I'm Brenda Sanchez.
I'm Justin Kagitla.
And Helena Bay.
So today we will be talking about our population, which is pregnant women, and the vulnerability of women using alcohol and other drugs while pregnant, health disparities of pregnant women, what healthcare resources are available for pregnant women, the ethical and political concerns, and the role of Healthy People 2030. Our vulnerable population are mothers using alcohol and substances while pregnant. This is a vulnerable population because using substances and alcohol while pregnant can harm not only the mother but the fetus as well. And the prevalence of perinatal substance use disorder in the United States is rising. There's a significant amount of pregnant women are reporting the recent use of illicit drugs, alcohol, or tobacco. Pregnant women who struggle with substance usage and alcohol can overall affect family life, safety, and the community. This can also stem from mental health and trauma. Many mothers who have usage of substances can suffer from these mental health disorders such as depression, anxiety, PTSD, intimate partner violence. And using these drugs can function and as a coping mechanism, and it's a difficult cycle to break. But with the usage of these drugs, it can affect preterm birth, stillbirths, and neonatal abstinence syndrome. Why they are vulnerable. This population is considered vulnerable because of the health risks to the mother and fetus. There are direct health risks involved for maternal and fetus health, social and systemic vulnerabilities. Some factors that contribute to this population are stigmas around substance users and being pregnant, such as guilt and shame. These barriers to prenatal care because of consequences due to usage of substances, and this can cause a mother to not want to reach out in the end for help. Another barrier is the access to the quality of healthcare that they have during pregnancy and childcare if they do have other children at home, and transportation overall. Individuals may be shamed and judged, and this increases the mother not to reach out for help. Financial and limited options due to poverty, lack of support, and lack of treatment offered in their community can limit mothers that are struggling. Pre-existing substance use disorders and illicit drug usage too, like I spoke about before. And mental health disorders is also a contributing factor to the population. According to the CDC, there was an increase of 131% of women who had opioid-related diagnosis within the last 7 years. Substances such as amphetamines are associated with increased maternal and fetal morbidity and mortality. Usage of these substances increase maternal hypertension, preeclampsia, placental abruption, and neonatal death in the end. And the usage of illicit drugs, alcohol, or tobacco can pass through the placenta and reach the fetus.
Health disparities of women who consume alcohol while they are pregnant. So, alcohol consumption during pregnancy, regardless of the amount, carries significant risk for both the mother and a developing baby. Exposure to alcohol during gestation can cause persistent abnormalities in the physical and cognitive development of a baby. So, there are a lot of risks that baby and mother can undergo through, and that's why alcohol consumption is really not advised during pregnancy, and therefore we need to support pregnant women who consume alcohol while they are pregnant. And exposure to alcohol during pregnancy can cause a lot of complications such as fetal alcohol spectrum disorder, preterm birth, stillbirth, intellectual disabilities, low birth weight, miscarriages, and also additionally, alcohol can negatively impact the mother's psychological and physical health, as well as her relationships. And health disparities, women who use substances while they are pregnant. So pregnant women who consume substances face significant health disparities, experiencing increased risk of both maternal and fetal complications. These disparities are not only due to direct effects of substance use on the developing fetus and mother, but also due to systemic factors like socioeconomic disparities and limited access to treatment and lack of support systems. So that's why we need to really screen pregnant women for substance use, because it possesses significant risks. For example, opioid use during pregnancy highly associated with preterm birth, stillbirth, and neonatal absence syndrome, as well as maternal mortality. Heavy smokers possess a greater risk of developing stillbirth and also increased risk of sudden infant death syndrome. There are a lot of resources available for pregnant women who are vulnerable due to alcohol and substance use, and healthcare providers can help pregnant women who use alcohol or other substances by implementing non-judgmental, supportive approaches, providing education about the risk of substance use during pregnancy, and facilitating access to appropriate treatment and supportive services. This includes screening for substance use, offering brief interventions, and referring women to specialist services when it needed. Also, they can assign them extra ultrasound and or other tests to screen for baby's well-being. CDC offer alcohol screening tool to check drinking and make a plan how to stop consumption of alcohol. There's also a Substance Abuse and Mental Health Services Administration, which offers resources and services to help women, including those with substance use disorder. They provide information on treatment options, recovery support, maternal health resources. Additionally, they offer tools and guidance for healthcare professionals working with this population. To support pregnant women, especially if they are struggling with alcohol use disorder, the healthcare providers or OBGYN also should really advise pregnant women to attend AA group, which is a fellowship of men and women who share their experiences, strengths, and hope with each other, that they may solve their common problems and help others to recover from alcoholism.
Okay, so when we are discussing about ethical concerns, and when discussing about alcohol and substance use during pregnancy, there is a key ethical concern that is often in conflict, which is patient's autonomy. We know that it refers to a pregnant individual, their right to make informed decisions about their own body and their own health. Even when these choices may pose risks to the fetus, we must respect that they have their autonomy. And this can become ethically complex when healthcare providers feel a duty to protect the unborn child. So yet they must avoid coercive or punitive measures that could violate the patient's rights. So it may be hard to counteract the mother's decisions to decide for her own body and to protect the baby's health. When the doctor is caring for the mother, it's not only the mother, they're considered two patients. And it is the mother's right to determine how she will care for herself and how she will make her own decisions. So alcohol consumption during pregnancy may cause a long-term to the fetal, such as intellectual disabilities and congenital disorders. We know that there is no safe dosage, so any amount could cause harm. It is a physician's duty to be beneficent and to promote well-being to both the baby and the mother. So positive steps that may benefit them both would be include other interprofessional help, such as substance use counselor. We might want to bring the partner in to give that support and being aware of the local resources to promote effective care. We do know when we are aware that quitting drinking or any substance use is very hard and it may take a lot of effort. So having a lot of support, not only from the provider, but from the partner, from the family, and having those interprofessional help may help the mother carry the pregnancy and trying to avoid such harm to the baby. Another ethical concern that is a worry is confidentiality. So the doctors, whoever is in contact with that patient, they have to put in the information in their medical record. So the law requires that any substance that is not medically prescribed should be reported by the providers. This act may decrease their trust. So it may influence on the care and it may influence on the patient's decision to rather seek help or not. So this is a big problem. So they may avoid seeking prenatal care, which is essential at the beginning into like the end of the pregnancy. So this is a crucial principle because the patient, they must be able to trust their healthcare provider with sensitive information, including their substance use. If they fear that there's legal consequences or judgment, they may avoid prenatal care, which ultimately puts them both at very great risk. So balancing the obligation to report certain behaviors with the need to maintain trust is a major ethical challenge in these cases. So the overall goal should be to provide non-judgmental, supportive care that encourages the patients to seek help without fear, while also considering the welfare of the unborn child. So according to the American College of Obstetricians and Gynecologists, it is imperative to establish trust between the mother and the provider so the patient can be confident enough to share any information that may put them at risk. These women, they are also very worried and afraid of being labeled as hopeless or stigmatized. If they are in a suspicion of substance use, it is required to take a toxology test of the mother, the newborn, and even after the delivery. So they're very worried if they're going to get in trouble or if something's going to happen. So they don't want to tell the provider if they had any use or they've been drinking. So a political concern that has been a major problem with these population is surrounding the substance use during pregnancy it's towards the criminalization of it. So in some states, pregnant individuals who use drugs or alcohol may face legal consequences such as child endangerment charges, incarceration, or loss of custody. In a lot of states, this is considered child abuse. So these laws are often framed as protecting the fetus, but they raise a serious ethical and public concern. So the criminalization of the act can discourage the pregnant person from seeking the prenatal care, like we have been saying, or addiction treatment. So out of that fear being reported of punished. So this ultimately harms both maternal and fetal health. It's also marginalized population, including women of color and those with limited access to healthcare. So from a policy perspective, many experts, they argue that the substance use during pregnancy should be treated as a public health issue, not a crime. So the focus should be on providing access to the treatments, education, and support. So not the punishment. So supporting pregnant individuals through punishment approaches leads to better outcomes for both the parent and the child. So, like we have been talking about, how this can be a stigma to them, is that the providers are not arguing that this approach undermines public health efforts and put these mothers at great risk. So, according to Prince, criminalizing substance use will not lead to improved clinical outcomes for mother on their children. So they're trying to fight that and trying to make it not a crime. So they're trying to promote more education and more, give them more support so they're not afraid to seeking help.
So Healthy People 2030, the first objective is about increasing abstinence from illicit substances among pregnant women. And some background information about this objective is that there's a 130% increase in opioid-related diagnosis. There's a higher risk for hypertension, preeclampsia, and placental abruption, and stillbirth risks are doubled with marijuana or any illicit drug uses. So why it matters, it can cause preterm birth, stillbirth, neonatal abstinence syndrome, intellectual behavioral disorders, and maternal mortality. And the role of 20 People 2030. So there's early screening tools, treatment referrals, community-based support, and policy and public health interventions. So for the next objective, it's all about increasing abstinence from alcohol among pregnant women. So again, some background information are that 1 in 9 pregnant women report drinking alcohol in the past 30 days. And out of those women, 40% of those who drink reported binge drinking. So why it matters, it can cause fetal alcohol spectrum disorders, low birth weight, miscarriage, stillbirth, developmental delays, and learning disabilities. And no amount of alcohol is considered safe during any trimester. And the role of Healthy People 2030, this sets national data-driven objectives to reduce prenatal alcohol exposure, promotes universal screening, brief interventions, and referral services. And lastly, it encourages public awareness campaigns and policy strategies for alcohol prevention. And there are a bunch of different resources that women can seek when they are struggling with these. The first one is the Centers for Disease Control and Prevention Alcohol Screening and Brief Intervention. So they're just a set of evidence-based tools and resources from the CDC for healthcare providers to screen patients for any alcohol use and provide brief counseling interventions. The second one is the Substance Abuse and Mental Health Services Administration treatment. And they provide behavioral health treatment, locators, helplines, and educational resources for individuals with substance use and mental health disorders. And lastly, there are a lot of local maternal health programs. So you can find these in any regions or local organizations, clinics, and health departments that provide services such as prenatal care, substance use treatment, peer support, and maternal health advocacy tailored to the needs of the woman and the community. So in conclusion, substance and alcohol use in pregnancy increases risk for preterm birth, stillbirth, neonatal abstinence syndrome, developmental delays, and maternal mortality. Vulnerable populations face added barriers, and these barriers include stigma, legal risks, limited access to care. Ethical concerns involve balancing maternal autonomy with fetal well-being, and political debates on criminalization affect care-seeking behaviors. And lastly, for the two Healthy People 2030 objectives, it focuses on prevention, early screening, treatment, public awareness, and policy changes. And it takes a collaborative effort needed from providers, policymakers, and communities. So these are our resources. And thank you.